why did you choose to come to the United States in the first place? You had been a doctor in Kazakhstan.
Well, that's many factors. I actually, at some point, I was in Vodrop and I had a chance to speak to Maharishi. I actually told him that I was about to go to India and study AyurVeda there. And I want to stop my medical training. And then at that point, then Maharishi said, well, how about you finish your medical school and then come to Fairfield and do the Vedic medicine there.
Now, you've been practicing, you're a teacher of TM? When did you get your training as teacher?
In the middle of my medical school, I still pursue that goal to find something immortal for my parents. And I found out that more I study, more I realize I study about the objective world. I know anatomy, physiology, biochemistry, but at the same time, I don't have an answer for all my questions. So I have become a TM teacher in my second year of medical school.
Now, what effect or you might say what benefits did you experience from having been a TM teacher or practicing meditation in the context of being a medical doctor with all the demands that you have?
Well, my program definitely shortened compared because I was in many different courses and trainings, and sometime I was even a short period of time of Mother Divine. But I realized it's two steps: rest and activity, and meditation sometimes let you get rest in a very short period of time.
When you went through this very arduous training, the total number of years you spent training was how long to become a doctor?
Well, mine was long because I combined regular medicine, but then integrative medicine, internal medicine, and AyurVeda, and I studied in 5 different countries. So that's why I basically in school since a very young age. So it's probably at least 15 years.
15 years of study. Wow. What was your biggest challenge when you came to the United States?
Medical terminology, because medical terminology is definitely very challenging. I remember opening the books and the one that I can read in my mother tongue, and then here I see that it's definitely something needs time to study. In your own life, what would you say are the strengths or qualities that you have or that you feel are the most important that got you through this career path to become a doctor? One thing what I want to tell all of you, what helped me, it's never give up. Just whatever you have, you just don't give up. And because there is always solution. And the other thing, I never was afraid of hard work. And I had a quality that I make, doesn't matter how hard the work, I try to make it fun. And if you can do that, then you can do most monotonous and, boring work and make it fun for you, and you can get the best out of it.
Could you talk just for a moment about something you alluded to earlier, that as a doctor you need to have technical skill to understand disease and diagnosing it and prescribing cures, but also there's the skill of being a people person. In your job, you have to relate to people, as you said, you have to listen to them complain all day long. So I'm wondering, can you just to speak a little bit to that, this balance of technical skill and what you might call people skills?
Well, I think being a doctor is a gift because you're able in the position to help. And how many of you would like to be in the position of someone really need your help and you can help? And I think health is the most valuable thing. And to be able to guide with that, I think it's most impressive. So for me, when people come and when they need my help, I actually feel that this is a privilege.
Now, you told me that in Kazakhstan there are many women doctors, whereas in the United States, I believe in medical school there's more men than women. What was it like to come from essentially an environment where most of your colleagues were women to an environment where it was a male-dominated environment? What kind of challenges did that present to you?
I didn't have any challenges, but I think dealing with men is easier when you're a woman, and I think
So that's why I never really felt like it's a challenge. But it's true. In many European countries, it's percentage of female doctors to male sometimes is 4 to 1, or somewhere around that numbers. Here it's opposite. Maybe because men has more luxury to be more dedicated to study and to training and to extensive long hours. So I'm not sure, or maybe it's just a stereotype, because I think female physicians can be so valuable, and I'm sorry, in this area there are not too many.
What has been your experience coming to Fairfield to work here as a physician?
Since I lived in Fairfield from almost 1998 to 2004, I always felt Fairfield is like my second hometown. So I knew so many people, and I knew some of you. You probably don't remember me. So I see like some feature I can recognize, but you definitely grown up. So that's why I felt like coming back home.
Now, I think maybe we can open it up to questions. So are there any questions from anyone about any aspect of what Dr. Karimova has spoken about, her career, her experience being all over the world, being here in Fairfield, being a doctor? Any questions? Yes, Avery.
So you studied for 15 years to be a doctor, you said. Did it pay off?
Definitely. If you just want to practice mainstream medicine, you don't need to study so many years. You can just do pre-med, and then you can do medical school and residency. Of course, it's still a long time, but it's not nearly as 15 years. In my case, it took longer because I just wanted to study more things. I was passionate, and whatever I was interested, I studied. So it definitely paid off because I feel I can incorporate. In my practice, I can incorporate mainstream holistic medicine, integrative medicine, and do more beyond than regular healthcare does.
Other questions? Yes.
Internal medicine.
Could you explain what internal medicine means? I mean, just the basic.
I'm only one internal medicine in town, and internal medicine is adult care mostly. So you actually will be able to qualify to be seen by internal medicine fairly soon already, maybe. It's basically all spectrum of adult care.
Other questions? Yes. Girls, any questions? It's your chance. Yes. Yeah.
You said you had to see if you had to become a doctor. What were some things that you used to help yourself see if you had
Oh, I never really had the question if I have what it takes. I just did it, and of course I had a lot of support of nature. I believe in that a lot, and as I told you, if you have a goal, you don't give up, and you don't afraid to do hard work. Anything can be done, anything, especially in this country.
Yes. Other questions? Yes. Yeah.
You're kind of superwoman. Is there ever been, is there something in particular that you felt was like a real struggle for you, or anything that you're struggling with in terms of being a doctor and having these responsibilities?
While in school, I always felt a little bit different. And I felt like it's actually weakness because I just don't feel like I can share everything that everyone did. But during the years, I realized being different, it's actually not that bad. And you don't need to feel bad about it. So now I still feel different, doesn't matter where I am, because of my background, because of my, being female, because of so many different things. But now I just feel that this is my strength.
Other questions? Dr. Karimova, I have a question. It has to do with you're working at the local hospital, which is not an Ayurvedic facility. It's a normal Western allopathic medicine is their orientation. How could you speak about how you are able to use your knowledge of Maharishi Ayurveda in that context?
Well, you know that a lot of time when physician does physical consultation and exam, sometimes you need a time to have lab work done or different diagnostic tests. In my case, I was able to take a pulse and do some pulse diagnosis that helped me to get some information before the test and clinical lab, available for proper diagnosis. So I think, of course, I cannot do Ayurvedic, and I don't want to do only Ayurvedic training because I train for so much more. So, but I feel that's a valuable tool, and at the same time, I can relate, I can understand my patient, I can, give some recommendation, and I think it's also very valuable.
Any other questions? Yes. Is there one over on this side? No? We're good. Okay? Yes.
Well,
Samantha.
you said that your advice was to never give up. Well, I'm sure there were times when it got really hard. What did you tell yourself to get through that?
Try to remember that it's not for the rest of your life. When we have a problem, that moment feels it's it. You just have, you feel like who knows for how long you have it. But if you just understand that could be just a short period of time, if you look at a bigger picture, then it's nothing. So that's why sometimes I just have to take one day at a time, take 1 hour at a time if it's that bad. But I don't think you guys ever will deal with what I dealt. You have much better supportive nature and karma and everything. So that's why you don't need to be that determined,
Any other questions? We're good? Well, Dr. Karimova, we really all thank you very much for coming out of your
Thank you again. Thank you for inviting. I see so much of intelligence. I'm so inspired. We have such a bright young community.